Good morning, everyone. I'm Dr. Brees. I'm the Medical Director for Emergency and Urgent Care Services for Memorial Health System.
I'm Dr. McElroy. Usually I'm a surgeon here at Merritt Memorial Health System. Today I'm dressed up like the Medical Director for the Washington County Sheriff's Office SRT.
Today we're going to be talking about the use and application of tourniquets. Tourniquets are found in many places in the pre-hospital setting and also in our hospital emergency departments and other locations throughout the health system.
There's two primary types of tourniquets that get used here in Marietta and in Washington County in general, as well as our surrounding areas. Probably the most common type is what's called the soft T, or the Special Operations Forces tourniquet. We also use what's called a Cat 1. You should see both. The Cat 1 is very similar, it just has some Velcro on it. There are quite a few other types of tourniquets out there, but that's a little bit beyond the scope of this video. So we wanted to demonstrate a couple of things today. We wanted to demonstrate the application of a tourniquet properly to the upper extremity and to the lower extremity. And then we'll talk briefly about the proper removal of a tourniquet. And
I will volunteer my arm.
Sweet. All right, so again, this is a soft T tourniquet. If you'll notice, there's a few things about tourniquets that are really important. They all involve a wide piece of cloth and then what's called a windlass. The windlass is necessary for mechanical advantage. Without a windlass, you cannot make a proper tourniquet. Then there also has to be some mechanism to secure the windlass after its application. So for an upper extremity, we'll pretend that Dan has an actively bleeding wound of his forearm. Ideally, I'd remove all the clothing first and put this directly on skin. Since that's not possible and Dan doesn't want to take all of his clothes off, we won't do that. So I've got this basically prepared with the strap already through the buckle, so all I have to do is slide it up on his arm, tighten the strap down as firm as it'll go. I want it as high as possible on the extremity, and I want it as close to the torso as possible. Once that occurs, I'm going to start to use my windlass. All right. Now, here's a fallacy about tourniquets. A lot of people think if it starts to hurt, it's too tight. You cannot make a tourniquet too tight. Okay? If it doesn't hurt as much or more than the wound, it's probably not on tight enough. So I'm going to do it to there for now, and I'm going to test, and I have the feeling that's not tight enough. We'll see. I'm going to feel for a pulse. Actually, the radial pulse is absent. I'm going to check my wound, see if the bleeding stopped. Okay? While I'm getting ready to apply the tourniquet, I can have a second person put direct pressure on my wound to decrease bleeding. Or I can, if I'm by myself while I'm getting the tourniquet ready, with one hand I can hold the wound with direct pressure, with the other hand I can deploy my tourniquet. All we're trying to do is preserve blood for the patient. Okay. Once I have the tourniquet in place, once I've ascertained that, yep, it's turning white and there's a lack of a radial pulse, okay, then I want to take care of the wound itself. I can put quick clot, C-locks, then I might wrap it with an Israeli bandage or pack the wound, whatever I think I need to do, but I want some sort of pressure dressing on this wound next. Now the patient's ready for transport. Once we transport the patient, every time I move them, whether it's to roll them, whether it's to transfer them from a transfer board to a bed, I need to recheck the tourniquet, especially if it's over clothing, because about 50% of them will become dislodged. Dan, does your arm hurt?
It's tingling.
Excellent. I have tried to talk as much as possible to see how long he would last, and yet he still didn't start to complain. I'm very impressed. So, since we have this...
I am an ER physician.
That is why I thought he would complain. But if it was the surgeon, he would have been whining long ago.
As you can see how the surgeon dresses today.
Absolutely, yep. Well, it's St. Patrick's Day. I had to wear green.
No pinching that, surgeon.
There you go. Now, since I have this in place, before I demonstrate the leg application, let's talk about the proper removal of a tourniquet, because that's usually in the hospital setting what we're going to be doing, because our pre-hospital personnel are going to have this in place already. So Dan comes in, he's on the bed. I'm the physician, or I'm the nurse. I'm going to check the wound. Do I have any bleeding through the dressing? If I do, I can either try to tighten this one, or I can add a second one. Okay. Many times the bleeding is going to be controlled by now. The body's made its clot. We have a pressure dressing in place, and so now we can proceed with removal. So what I'm going to do is I'm going to look. Do I see any bleeding through? No, I don't. Okay. I'm going to go ahead and I'm going to loosen my tourniquet.
That's a wonderful idea.
Yeah. But I'm not going to remove it yet. I'm going to leave it right there. Okay. Have pressure on my wound. I see color come back to the extremity. It looks a lot better red than it does white. Now, I'm going to expose the wound. All right. look under my dressing. Do I see bleed through now? If there's no bleeding, now I can go ahead and assess the wound and basically employ proper treatment. If there is active ongoing bleeding that is poorly controlled, my tourniquet's still in place. All I have to do is tighten it back up and basically call the appropriate person, whether it's the trauma surgeon, the vascular surgeon, so on and so forth. All right. Did it hurt?
No, just tingling. I mean, you do feel pressure in that area.
The longer the tourniquet's left in place, the greater tissue ischemia you'll induce and the more pain they will feel. Any tourniquet removed within 2 hours will typically not cause any tissue damage. Any tourniquet left on less than 6 hours will typically not require extremity amputation. So if you think you're going to be in some sort of setting where you're going to be delayed beyond 2 to 6 hours, you might occasionally take the tourniquet, loosen it, allow some perfusion with direct pressure on the wound, and then reapply the tourniquet. For a lower extremity wound, if you look to the soft T, we talked about the strap, we talked about the windlass. Okay, there's also the buckle. And a cat tourniquet has the same thing. For a lower extremity application, you have to make sure that it's threaded through both portions of the buckle. Otherwise, you can't generate enough force to appropriately crank down the windlass. All right, so I'm going to give myself plenty of room for this gentleman's massive thighs. All right, I'm going to take his leg. Again, hopefully I have a second person to start applying this. Move his coat out of the way. If I have time, and I'm not in an environment where I'm receiving active fire, I'm going to cut the clothing off and apply this directly to skin. Again, I tighten the strap down as much as I can. I want to be kind to Dan, so I'm going to move the windlass away from sensitive areas.
Thank you, Dr. McElroy.
You're very welcome, Dr. Brees. I'm going to crank this down, and that's going to do it about right there, I bet.
Boy, that feels nice.
Yeah. Now, same thing. Going to assess for his pulse, which is, ooh, he's still got a little pulse. So I'm going to go one more crank.
Yep, that one you can feel a lot more than the one up on your arm.
Yeah, boy.
Yeah. Yeah, that one hurts.
Yeah.
That one's good.
So the class that I went to originally, one of the classes I went to, was with a bunch of Special Forces guys. One of those guys was told that the record was 14 minutes, so he wore one of these for 18 minutes.
Not looking to break a record.
Yeah, me neither. Me neither. Yep, pulseless. If we took his shoe off, he'd probably be turning white. I have no desire to take Dr. Brees' shoe off.
I wouldn't recommend.
Again, we'd reassess the wound. We'd check for active bleeding. If there was still bleeding through the dressing or from the wound, in this particular instance where I feel like I have that one as tight as possible, then I'd apply a second tourniquet. Ideally, if you have to put a second tourniquet on, you go above the first tourniquet, but if not possible, then you can go below it. What do you think? Does it hurt?
That one you can feel a little bit more than on the arm.
Lower extremities definitely hurt a little bit more, so we'll take that down for him.
Good, good.
And that's about it. Quickly do the demonstration of a self-application of a tourniquet. This would be primarily for those who are in a situation, whether it's law enforcement or you're basically incur some sort of injury and you're by yourself. So I have my tourniquet pre-set up. This is a soft T. If you'll notice, I've already got the strap threaded through the buckle and it's ready to go. All right, so if I have body armor on, then I want to get this as high as possible. I'm going to take the body armor off. Okay, I'm going to slide it up on my arm as high as it'll possibly go. The only thing you need to do is hold that tourniquet against something, whether it's the wall, so I can crank it down and tighten it. Once I have it tightened, I want to be able to access my windlass, and I need to be able to secure it. All right, so I'm still holding it against the wall. I crank that windlass down as tight as I can. And if I do it right, it's going to hurt, which it does. I need to get that a little tighter, actually.
Funny, mine did not hurt.
That's because you are tougher than I am, my friend.
Physician, that's
There
correct.
we go. Oh yeah, that's a good one. One more crank for good measure. Basically, I secure that in the windlass, and I'm going to assess myself, which I might or might not do in the field, obviously, but I'm going to do it for your sake. Pulse is gone, hand is turning white, and that's that. The key really to self-application of an upper extremity is to bolster yourself against something like the wall. For lower extremity, it's a lot easier, obviously, because then you can use both hands. That's it.
Oh,
There's a few.
Looks like you're having trouble releasing that one.
Oh yeah, it's super tight.
Yes, I
I'm gonna have to just leave it. I'm sorry.
It's a good thing I brought my trauma shears.
Yeah, amen to that. If you can get those trauma shears in there, I'd like to see it.
That's okay.
There we go.
You getting all this?
Tourniquet against something, whether it's the wall, so I can crank it down and tighten it.